Hello students, I want to talk to you about the nursing process. In your book called ACLY, there is an acronym for the nursing process and it's called ADPI. So ADPI stands for, the A stands for assessment, the D stands for diagnosis, the P stands for planning, which is consists of outcome and interventions. The I stands for implementation, and the E stands for evaluation. So many nursing students use this as their acronym. So the nursing process is a way that we think. It's a way that we problem solve for the patient. It's a way that we prioritize our thinking and our plan of care for the patient. So it's very important to use this process so that we can critically think and we can formulate nursing diagnosis and we can intervene and we can evaluate the patient to see if those interventions actually are working. So the first part of the nursing process is assessment. And assessment is extremely important. And when we think of assessment as a nurse, we think of the patient holistically. So we are thinking about the patient's physiological concerns, but we're also thinking about their psychological concerns. We're thinking about their available resources, environmental or social context. We are thinking about their knowledge and motivation. So when I think about someone's psychological concerns, I think about how are they dealing with their illness? Do they feel stressed? Are they adapting okay? Do they feel overwhelmed? Okay. Are they struggling with anxiety? Are they really emotional? Is the patient crying? So those are things that I think about when I'm assessing a patient. How well are they dealing with this emotionally? When I think about available resources, I think about their environment. So I always take into consideration an elderly person. What environment are they living in? Are they at home? Are they in a nursing home? Do they have support? So I also think about family dynamics. Do they have family support that comes over and sees them and helps them, maybe with their grocery shopping or with cleaning the house? I also think about social context. Do they get out? Do they go to a community center? Are they socializing? Because all of these factors affect someone's health. And then I also think about knowledge and motivation. Do they understand their disease process? Do they understand how to take their medications? Okay, and I think about motivation. Do they want to get well? Are they in denial about their illness? So these are things that I think about when I'm assessing the patient. The other two things that we think about with assessment is we think about collecting data. And there's a lot of data that we can collect from a patient. And some data comes subjectively, which means what the patient states. So if the patient comes in, they state, I'm having chest pain, that's subjective data. Or if the patient states, I fell down the stairs and now I'm hurting, those are all statements that came from the patient. Objective data is considered everything that we see. So seeing would be like the patient's diaphoretic, the patient's grimacing, the patient is tremoring, okay? We can see all of those things. So we can see if they are in pain by seeing if they are grimacing. So it's everything that we see as a healthcare professional, okay? When we're collecting this data, we have to really kind of understand what all this data means. And a lot of times we have to kind of cluster the data that we obtain either subjective or objectively. So we have to cluster it. We have to ask ourselves, what does it mean to us? What do we think is going on with the patient? Okay. So that's very important for us to understand it so that we can actually formulate a nursing diagnosis. So clustering is recognizing the information, sorting through it, organizing it, and taking the information and clustering pertinent data together. Okay, and then determining what the client's need is. So when we're doing that, we can look at what's called Maslow's hierarchy of need. And in the back of your ACLY book, you can see on page 946, you can see 949, excuse me, you can see the Maslow's hierarchy of needs. So it's a triangle, and you can see that the base of the triangle are your physiological needs. So after we've collected this data, we can kind of start to prioritize and say, is our physiological needs being met? And physiological needs would be including oxygen, food, elimination, temperature control, rest, comfort, okay? Safety and security would be, are they safe physiologically and psychological threats, protection, lack of danger, okay? Love and belongingness is affection, intimacy, and support and reassurance. So when I think of those, I think of some of their emotional concerns that they have. Self-esteem would be respect, independence, dignity, privacy, and then self-actualization would be their health and autonomy, their knowledge, being able to understand things, okay? So that helps you understand using Maslow's hierarchy of need, okay? So the next part is, once we've clustered the data, we've understood the data, we've analyzed it, we now have to come up with a priority nursing diagnosis. And we can use Maslow as our assessment guide, to try to pick that nursing diagnosis. So there are different types of nursing diagnoses out there. The first one is, I'm going to call it a 3-part nursing diagnosis, okay? So a 3-part nursing diagnosis means that there's 3 parts to it. There's a problem, there's an etiology, and there's a symptom, okay? The problem is the nursing diagnosis that you pick. So for example, if I have a patient who is having a very hard time with nutrition, let's say they're not eating really well, they used to weigh about 150 pounds, and in 3 months, they're now down to 110 pounds. They kind of have stopped eating. They feel very nauseous. They're vomiting. Their BMI has dropped from, let's say, 30 to now 15 within a 3 months time span. They are not, I do a 24-hour food diary, and they're not eating the correct foods, the correct amount of fruits and veggies and protein and carbohydrates. So after doing all this data and after clustering it all, so I cluster all that data together, then what I do, and I know that it's about nutrition, and I prioritize nutrition as my nursing diagnosis, then I formulate the nursing diagnosis, which you can use in your Ackley book. They have them listed out, and you can use them. So I would come up with imbalanced nutrition related to loss of appetite, okay, as evidenced by the patient's BMI is now 15. It was 30. The patient was weighed 150 pounds, and in 3 months, now they're down to 110 pounds. The food diary, what they stated they ate in the last 24 hours, that they look emaciated, and that they feel nauseous, and they feel like they've been vomiting. So all of those would be my symptoms, okay? So the etiology would be that they have a lack of appetite. So, and the symptoms would be everything that I am trying that is from my data, from my assessment data, okay? So that would be a 3-part nursing diagnosis. And that's also called a problem-focused nursing diagnosis. Problem focused. So it's an actual nursing diagnosis, an actual problem that the patient is actually dealing with at this time when you are encountering the patient. A risk nursing diagnosis would be a 2-part nursing diagnosis, okay? And that's a clinical judgment. That's a potential problem. So that would be an example of that would be a patient has an unsteady gait and uses a walker, and I start thinking about they're elderly, they're 88 years old, they live alone, All of that data I would collect, I would cluster and say, well, I think the patient has a risk for falls, okay, or risk for injury related to decreased physical mobility or unsteady gait I could use. Okay, so that would be my related to. It's a two-part nursing diagnosis. So there's no symptoms involved in the two-part nursing diagnosis. Okay, so that's your different nursing diagnoses. Okay, so once we pick the correct nursing diagnosis or the priority nursing diagnosis, then we have to develop what's called outcomes. We have to make a plan. Okay, and the outcomes need to be specific, measurable, attainable, reliable, and timed. Okay, so we use the acronym called SMART. Okay, it's called SMART. So it's specific, measurable, attainable, and realistic, not retainable. It's realistic and timed. Okay, so those are the acronyms that we use. So when we're looking at those, we want to develop outcomes or create outcomes that are specific. So let's go back to our patient who has imbalanced nutrition, less than body requirements related to decreased appetite. So we want to make outcomes that are specific to that patient's symptoms. So one of my outcomes could be that the patient would gain 1 pound every 2 weeks. Okay, so that would be my outcome, that they would gain 1 pound every 2 weeks, that their BMI would increase to maybe 18 within 2 months. Okay, so that would be my outcome. You can make short outcomes or short goals, or you can make long-term goals. Usually if they're admitted to the hospital, we make short-term goals because they're not there that long, and we want to make sure that the goals can be accomplished during their time in the hospital. Okay, so another example would be like if a patient, the patient who has risk for falls related to unsteady gait. One of my outcomes would be that the patient would not fall during their admissions to the hospital. Okay, so during their time in the hospital, they would have no falls. That would be an outcome. You always want to make sure that they're attainable to the patient. So the patient should be agreeing on these outcomes, that they should be realistic for the patient, and that they should be timed within like an 8-hour time frame, within a 24-hour time frame, within a couple months, depending on if it's a short-term or a long-term goal. Okay, so that's outcomes. And you would create as many outcomes that are specific to that nursing diagnosis. So you'd have to look at your patient and figure out how many outcomes should I create? How many outcomes are specific to that patient? After we create the outcomes, then we go on to interventions. And in your book, ACLY, they list a lot of interventions under each nursing diagnosis. So you want to pick interventions that are specific to your patient. And the last thing we want you to do is just to copy interventions specifically from ACLY. So they want to be specific to your patient. They want to be interventions that correlate to your nursing diagnosis. So you want them to be, and you want to look at holistically all the interventions that are specific to your patient's nursing diagnosis. Okay. So that would be interventions. Once we created the interventions, then the next step would be evaluation, okay, which is the last step. So in evaluation, we want to see if those interventions actually are working. And we want to evaluate if those outcomes have been accomplished. So we would go back to our outcomes and see, did the patient gain weight? Did the patient gain 1 pound after 2 weeks? And if the patient did, that'd be great. What if the patient gained a couple pounds? That would be even better. So they definitely accomplished that goal. Did the patient's BMI go up to 18 in a 3-month time span? And if it did, then you accomplished that goal. If you didn't, then the goal was not accomplished, and you have to reevaluate that goal. You might need to change the goal. You might need to add in more interventions, and you might need to think about that. Okay, so that would be evaluation. Back to interventions, the one thing that I try to teach the students is 3 different types of interventions that I use is called assess, treat, and teach. So as a nurse, I feel like I do a lot of monitoring and interventions. So I'm monitoring to see if the patient is eating, 3 meals a day, how much they're eating. Treating would be to weigh the patient every day, or every other day, or maybe weekly, depending on what the orders state. And education would be teaching them about specific food that they should be eating. Okay, so educating them on the importance of eating, fruits and veggies and carbohydrates and how much they should be eating, and giving them a specific diet plan. That would be education. So that's kind of how I look at it when I'm working with a patient. I hope this video helps, because I'm trying to help you understand the nursing process. Now that you've watched the video and you've read the chapter or the pages in ACLY, the next step to this module would be to complete the case study. So the case study is going to go over and try to apply the nursing process. If you have questions, please reach out to your faculty, and they can answer it regarding the nursing process. Thank you.